There it goes.
Oh.
Take my breath away.
I've been trying to get that to pop for so long.
Yeah. All right.
Oh, that was the one. What? Oh my gosh, that felt so good.
I had one chance.
One opportunity.
It's not even one opportunity. This is all you had.
Nothing you ever dreamed of.
Lose yourself in the music. Mom spaghetti. There you go.
Oh my gosh, I get why they make that face now. Oh, that's so weird. Okay. Okay, cool.
Oh my goodness, look who's walking outside. Look at this. Look at this iguana.
Oh my gosh, that is huge.
Look at that monster out there.
Oh my god.
What do you feel? Tell me.
So like I have a lot of tension upper back. It's mostly my right side.
Okay.
And then my hip and my glute, she's uncomfortable.
Okay.
Maybe pinching sciatic, I don't know, maybe not.
Anything going down your legs?
A little bit, but it's not often, so I don't know if it is.
Tightness or numbness or just pain?
Pain.
Pain?
Mm-hmm.
Okay. And that's been going on 3 months or for years?
The one in my upper back's been like years.
Okay.
The lower back is just recently.
Okay. More than 5 years ago, you had a car accident?
Yeah. I got a DUI, so.
Okay.
And then after that, I had a few other accidents.
Okay.
So, you know, we've done some damage to her.
Did they take any pictures? Did you go to a chiropractor for those accidents, or did they examine you? How was the treatment after those accidents? It kind of just winged it?
It kind of just winged it, yeah,
Okay.
honestly. I just remembered, sorry. I also may have fractured my tailbone from a drunken incident.
There's more, okay.
Yes, we love that. I am a year sober now, so like we're catching up on lots of things.
Okay. Is there numbness in your arms or down?
Yeah, so this one for sure. It's always like right in here. It's like kind of.
Right now, is it feeling that?
Mm-hmm.
Uh-huh.
And then when I've been getting back into the gym, so I'm trying to like video and watch my form. And I noticed when I do like this with the barbell,
Yeah.
it's like
Not
one
even.
side's completely off, and I'm like, oh, that's not right.
Strength isn't even.
Yeah.
So the nerve controls motor, reflex, and sensory. So since sensory, you're feeling things. Motor, it's not working properly.
Yeah.
Even your reflexes would be affected. So we're dealing with disc injury, and in our 30s, we're not going to see it with X-ray. We have. That's why I was asking about an MRI. We have to see the discs, and it's nerve pressure causing the sensation down your arm.
Yeah.
Part of your neck is overstressed. The car accident set us up for this. So when we have injuries, parts of our spine quit, parts of our spine are punched in the face, and then they get further injured through life as holding trays and working. And all right, so let me see what else was here. Lower back. Okay, let me look at your posture. Go ahead and stand up for me.
I have also terrible habit of cracking my neck.
All right, back girl.
Yeah, like I'll wake up and it's like one of the first things I do.
All right, you do that. What? Just taking it and don't do it.
I like. And it's just like, and it's such a sense of relief. It's hard not to do it.
So
I know it's so bad.
I understand your desire. What you're releasing is pressure from a joint, but the problem is you're mainly popping the ones that are probably already injured, further loosening them.
Yeah.
And it creates a positive feedback loop where you just have to constantly. The whole goal of the chiropractic is to do two things. One, to make another part of your neck that isn't injured work so that area no longer feels the need to be popped. And then we're going to talk about this guy, which is going to be your savior for your neck, which is the Denroll. This is the curve that your neck needs to be in.
Yeah, when I look back, sometimes it'll like, I can feel it down both arms.
Right. So what's happening is you're pinching the nerve when you. So this is the front side of us. These are the little spinuses that we feel on the back side of our body, and then I'm going to use the lower back just because it's bigger.
Right.
So the nerve is coming through a little hole, and there's a disc that's starting to occupy the space that the nerve is traveling through. When you bend forward, the hole gets larger, and then when you bend back, the hole gets smaller. And this is typically why our bodies
hunch forward
to get away from it. And then that's why you're saying when I bring my head back, it goes down both my arms because then you're actually pinching the nerve. Now, So then why, Dr. Ed, do you want me on this neck den roll? Well, we have to get the weight off the front part of the disc, which is why the disc is shifting backwards. Now, when
that makes sense.
it's because there's so much pressure on the front, which is why it's shifting. So we do need to, the hole's gonna get smaller, but at the same time, the disc is gonna start moving away from, with the understanding that when we bring you back, I don't want all the bending happening where you're popping your own neck.
Right.
I want it happening in a more even approach, which is why you shouldn't be doing this. That's why they make me sell these things.
Yeah.
Because you're not supposed to be doing extension with your whole spine not working. We gotta
Right.
make sure that your whole spine is working evenly so that we can safely bring your spine back into the lordotic curve position. So we're about 1 inch forward. The middle of your shoulders about here. Your shoulders are rounded a little bit, so if you can look at me. So the head's forward, but the shoulders are forward, which hides it.
Okay.
So if I actually pulled your shoulders back,
It would be like this.
it actually looks worse, but I'm not gonna depress you too much initially. All right, let me look at your hips here. Just gonna see, sometimes the hips will be, left hip is low, right hip's a little bit high. So the pain was going down your
This
right leg,
leg,
okay?
yeah.
All right, let me keep looking at you. And the shoulders.
Oh, I had knee surgery like a year and a half ago. This one I tore my meniscus, but like it's golden, nothing hurts, it feels great.
All right. Let me keep looking at you.
Oh,
Sorry, you're fine.
Trying not to
You're fine.
overcorrect myself.
Left shoulder's low. I'm just looking at where you are. So our alignment of our spine is like the alignment of a tire on a car.
Right.
If the tire's not on straight, the tire wears out unevenly. It doesn't make it a
Mm-hmm.
diseased tire. It's, we don't call it Michelin. I got sold a tire that wore out unevenly, right? It's the alignment,
Right.
And we don't live in a world where there's many chiropractic orthodontists kind of idea where we want to get you back where you're supposed to be and not through a muscular contraction.
Yeah.
I have good posture now because I've strengthened my rhomboids.
Right.
I want you to have good posture, and that's where you want to be. In order to do that, we have to what we call mirror image stretch you. So we have to loosen your spine and then arch you back.
So sometimes when I touch it, it's like I can't feel it.
Okay.
That's
You can't-
prob-
in
like
between-
it's almost like nummy in here.
Uh-huh.
And like I'm like, oh, I can kind of feel it, but it's like not full.
The lower neck and the shoulder blade are the same thing. So we call this
Gotcha.
pain
okay.
referral.
Right.
So there's the joint in your spine that's what you're popping. When the joint's inflamed, you'll get pain, numbness, sensation in this area because this dermatome is controlled by the nerves that exit your lower neck. So an inflamed joint can irritate the nerve. And then you also have the wire going out that goes down your arm, then getting affected. So they're both going to happen together. We
Okay.
have the referral pain, and then, so we have to take the pressure off your lower neck. We want to get your upper neck working better, and that'll take the stress off of, which is supposed to be your secondary engine. This is not supposed to be your main driver. Your main engine's supposed to be up here. So this area is
Fun
probably,
facts.
well, it's probably not working properly.
Oh, gosh, okay, I'm ready.
Take a deep breath in. And then let all the air out. Let it all go. Here we go. A little deeper. Here we go. Yeah, a little tight. Deep breath in. Here we go. Exhale. Wow, nothing. Okay. Deep breath in. Okay. Exhale.
Oh, that was like,
That was your
sorry.
haircut. If your upper back moved beautifully, I'd be confused, right?
Yeah,
So
but it doesn't, so.
right, that's why you're here. That's what we have to fix. This area not moving
Yeah.
allows your lower neck to do extra. Now, when you how often are you going to the gym, and are you doing free weights mainly, or do you calisthenics, or is it mainly weights?
Mainly weights. I go typically like 5 days a week.
Okay, you need a car mechanic. You're gonna need. It's just you can
Yeah.
get away with this in your teenage and early 20s,
But not.
but now into your 30s, it becomes difficult to off-road your vehicle all the time without busting some bolts. When you're holding a tray, you don't walk with a tray. I'm sorry.
It's
Nobody
okay.
walks with a tray like this.
Yeah.
You lock your chest, right? Right? Seriously,
Yeah.
right? You lock your chest because you don't want to drop this thing.
Yeah.
Right? So holding a tray, my point is of the goofiness, is that holding a tray encourages your chest to be stiff. Right?
It does, yeah.
You don't want your chest to move when you're
Especially when
holding
I'm
a
holding
tray.
it like this too, yeah.
Right, you lock your chest. When you're bench pressing, your chest, you don't do it like this.
Yeah.
You lock your chest, even this. So everything is encouraging rigidity, and that's great for being on the cover of a magazine, but not great for making your spine make it to 90. There we go. Take my breath away.
I've been trying to get that to pop for so long.
Where does it hurt?
Like
Right
in
in the lower
here,
back.
yeah.
All right, so this is doing everything, and this is doing everything. We've got to get your hips moving and your middle back moving to take some stress off your poor lower back.
Understood, okay.
All right, deep breath in. Exhale. Yeah, it's just locked. Face up. It's okay. All right, face up. I know.
Oh.
All right, face up. We got work to do.
Real tight. I'm letting you know right now.
And it's okay. We'll get everything moving for you. The big knot here on the right. Jeez. Nobody's taking care of you. Winging it, airhead.
Yeah.
The whole leg, that's it's beginning of sciatica.
Yeah.
You're irritating the nerves that go into the area
Yeah.
that you're pointing to, and those muscles are going to contract.
Mm-hmm.
It's because the lower back's upset. Because your hips don't move. Because your
Right.
middle back doesn't move. Your lower back's pretty much the only guy who shows up to work and...
So you're saying I'm not Shakira?
Well, I
My
didn't
hips
say
don't
that. You can be Shakira, but we got
could,
to
but they don't move.
To safely be Shakira, we gotta get you moving. It's okay. It's okay. Chin up. There we go. Hold deeper in a second.
Oh, that was nice.
Go deeper. Yeah. All right.
Oh, that was the one. Oh man,
I
that
know.
just like produced
Mhm.
tears of goodness.
We got to get your neck moving. Yeah.
Oh.
Look at this knot right here. That click right there is an injury, and it has to be untangled. Feel that?
What do you mean? I feel it all the
Yeah.
time.
Oh my. Jeez. It's become my new roommate. It's my buddy. Got to get evicted.
I have been a lot better lately about like stretching and using my foam roller, and
Okay.
I have like it's not a tennis ball, it's like a hard ball.
Uh-huh. Yeah, we got to teach you how to use all that stuff. We have
So proper use of them is probably a good idea.
to,
Okay, I'm trying to just relax and like let you do
You're
it.
good.
My body's so used to like, no, don't touch that.
Your neck belongs,
Oh,
back here.
oh my Lanta.
This is home. Have you had any GuaSha before? Has anybody ever?
So I actually have one,
Mm-hmm.
and I may or may not have like bruised my leg a hot minute ago on accident
Uh-huh.
because I was like going too hard because it felt really good. Oops.
Right, I got you. Okay, not a.
It feels great.
Right.
I just left a huge bruise on my leg.
It's good. Well,
Oh, that's okay.
you got to get some blood flow. Just blood flow. Just trying to bring nutrition and
But yeah, no, it's don't mind.
right there. It's all clogged up right there. There we go. What was your teenage years? What gymnastics, or were you doing like the teenage years?
Yeah, I did cheerleading for a while
Mhm.
actually, and
Were you the girl getting thrown in the air?
I wasn't. I was the one throwing the ones.
You were
in
the
the
one throwing
air.
there. Okay.
My thighs are way too thick to be being thrown in the
It's all.
air. That feels good.
You'll see some marks on your spine when your family members look at your back and go, "Oh my gosh."
Oh, that's fine. I've had cupping done before,
Okay.
so
All right,
that feels
I've
great.
seen some marks on you before. Okay.
She told me I looked like a stegosaurus when she was like putting it on there. I was like, oh, okay.
There we go. Your neck is getting there.
Oh, I didn't realize how much the left side hurt until you started rubbing it, and now I'm like, oh.
Mm-hmm. The right side actually. This is actually. Oh, we would say listening, and then the left side over here.
Yeah, that's the one that I was like, oh,
It's
she
kinked.
she hurts.
Yeah, right there. Oh man. Yeah. Frankenstein bolt. Mm-hmm. Thanks, Ed. Yeah.
When I was feeling that the other day, I was like, there's no way that's a knot.
Yeah. Yeah. It's,
No, it is.
yeah. I get it. Your head likes to tilt right. Doesn't like to tilt left. So we got to get your head on straight, essentially. There we go. All right. I got you. I got your head. I got
I
you.
gotta make noises.
It's okay. It's okay. Let it go right here. Shoot up for me. There it is. Yeah. Okay, all right, it's okay. That side already pretty much went in, but that left side needed it. There we go.
Oh, that felt delicious.
Just hold that for a second. Oh my goodness, look, it's walking outside. Look at this, look at this iguana.
Oh my gosh, that is huge!
Look at that monster out there.
Oh my god.
Holy crap.
What the heck?
The dragon
Go
come to
get
see us.
Ethan. Oh, I'm sorry. Can I get my
Yeah, of
phone?
course. Oh my gosh, absolutely.
There we go. Right there.
Mm-hmm. That's the stop posters. Ooh, that part's mad, huh?
Mm-hmm. It's frozen. Yeah, I've had this locked down for too long, and now it's not going to welcome me with open arms and go, "Oh, thank you, Dr. Ed, for busting me loose. I've been on vacation." There you go.
Just keep saying, don't hold your breath.
Just breathe.
Like a sore elbow at the end of the day.
No, my elbow does just fine.
Oh, okay.
Yeah.
He's like, sorry about your luck.
That's right. Aren't you going to get worn out? No.
Ooh. Man, that's crap. Tight. Tight. Ooh.
Yeah, over here too. Just gotta unlock this.
Oh my gosh, when you just went up.
Mm-hmm. Look at that knot. Yep. Mm-hmm. Right there.
Oh. Oh, that's delicious.
Delicioso.
Delicioso. I did not realize how bad that top was until you touch it. My arm starts twitching.
Mm.
Oh. Just was holding my breath. Oh. It's like sheetrock.
Mm-hmm. Somebody poured something in here.
Just hardened. Oh. I can feel that one in my fingers.
Mm.
Is that because of the pressure on it?
Just trying to move the rib down. These ribs are raised here, so yeah, they're in close proximity to the wires that go down your arm. And
Oh, man.
when the head goes forward, it leverages these up. So we got to bring the head back and then also try to leverage these down. But nothing's moving. We got to get your back unlocked first for any movement to take place. We got to.
Is that why, like, some people have, like, that hump on their spine?
Right. It's avoidance, but also stiffness.
Mhm.
And
Getting in there deep.
Mm-hmm.
I have a feeling that's not supposed to be that crunchy.
Nope. Normal crunchy zone. Yeah, no. Not supposed to. It's like you move the couch and then you're like, oh.
That's kind of dusty.
I didn't realize what was underneath the couch.
That's where the remote went.
Ooh, look, a Skittle.
Oh, my Atlanta.
Okay.
Oh.
Mm-hmm.
Is that the GuaSha?
Yes.
Oh,
Yeah, all this just tangled.
the goosebumps. It's not the same when you try and do it yourself.
I know.
Oh.
Right there.
Oh my gosh. Is that shit like bulging out?
Mm-hmm. Well, it's not curved. It's straight down here, and so we got to get some arch. You know, bring your spine back to where it's supposed to be. Just right there. It's popped up.
That's that spot.
Let it go. Exhale. There you go. Breathe. It's okay. Exhale.
Oh my God.
Okay, you okay?
Yeah.
Here we go. Exhale. There you go. There we go. Good. Okay. All right. Keep breathing. I'm a greedy Chiro. Good. There it is. Good. We got a little bit. You okay?
Yep.
Arms back down, Tony. Okay.
So is that because she's already just right to that threshold?
We're just,
Yeah.
we have to start arching your back
Yeah.
without making it too pissed off.
It's like, yeah, sure.
Yep. It's tough. Good. Breathe. Good. Good. Breathe. Breathe. Good. Breathe. We're just dealing with low tread. I only have so much room for that nerve, and as I move the furniture around, then
It's like, oh, hey.
yeah, hey, I was standing here. You weren't belong. You're not supposed to be standing there. You know, jeez, that's. You know, you mentioned tensor fascia lata earlier. You know, it's the nerves that basically are, you know, control your lower back controls that, and so we got to get this all. And no soreness in here.
Oh, hello.
Mm-hmm. Sitting locks this joint,
Yeah.
and
I already noticed
gymnastics, and whatever, you know, all this cheerleading and
it. Hitting trees.
hitting trees with you know, traumas. And,
Falling. Oh gosh. I was a messy drunk. I hurt myself a lot. That's not a bad noise. It's a good noise. You can keep going.
Oh, here we go.
I'll tap out if it's
All right.
too much.
Fair enough. Okay. All right.
Cool. That's the spot. That should not be that tight. Jeez. You would think I never even massaged my body a day in my life.
Feels nice.
Not the calf.
Put my knee on my foot so it doesn't move.
I was gonna say, did you just pin her foot?
Yes.
Stay there. Oh, I need with this.
How's your arm?
It's more in the thumb part now.
Yeah.
Alright.
Look at that.
He's like, great.
Jeez, poor neck. Yeah, just we're close to the cliff edge.
Can't
And
handle extension yet.
Ooh, that's tight. Oh.
If you get this one to pop.
oh, come on. She's going to give me the challenge, isn't she? On slippery socks.
You can take it off if you want.
Oh, man. That's so funny. The real chiropractor will be able to get it to move.
What? Oh my gosh. That felt so good.
Nice.
Tears.
Oh man, hello.
There you go. Mm-hmm. You have like one chance to get it. You got to get it like right away.
Yeah, that was good.
Yeah, I don't know. I think I semi got it. I should have full committed. I didn't. I wasted it. Yeah, that's already. I had one chance.
One opportunity.
It's like one opportunity. This is all you had.
Nothing you ever dreamed of.
Lose yourself in the music. Mom spaghetti.
Oh, my boyfriend thought he said my arm's spaghetti
Mom spaghetti.
instead of mom's spaghetti. He's like, mom's a spaghetti.
My arm's spaghetti. He's nervous, looks calm and ready to drop bombs.
It's all spaghetti. We
He
just
wrote down, the whole crowd grows so loud, he opens his mouth. Let the words all come out.
so good.
Wait.
And over here like, and today he learned he knows the whole Eminem song. I pop those too.
No, mine.
I do. Because I have like my plugs and I can just like pull on them and just.
Go ahead and tilt your head left for me.
Oh.
Oh, I got to plug. Oh.
Shoot.
All right, let's go. Tilt your head left. Yeah.
I just got goosebumps all down my arm.
That was nice.
Okay, I promise I won't crack anything by myself.
I'm a licensed chiropractor, okay. All right, there we go. Go ahead and tilt to the right. Okay, no,
Oh.
that side, okay. On that side, let's go to this top guy. Tilt to the right.
Oh, that was a big one. That was good. Oh man, the goosebumps.
Woo!
Okay.
Kind of look up a little bit for me.
Yeah.
All right, I'm going to have you press back into my elbow a little bit with your elbow. There you go.
Oh my gosh, I get why they make that face now. Oh, that's so weird. Okay. Okay, cool. She's ready.
I didn't believe that was going to work.
I was like, why did they make that face? It's not that weird.
It is.
It is. Okay, cool. That felt cool.
Let me press back right here with my elbow. Press back into my elbow. So right here with that. There you go. There you go. Yep, it's okay. We'll see if we can get it. Press back. You have one chance. It's the one chance, girl. Got one
I got
chance.
this side though, so it's okay.
It's ultimately on the right because her left upper part of her neck. You get the idea? This is what's locked.
Mm-hmm.
You're abusing the right lower because your neck doesn't work over here, so the
Right.
right lower is compensating.
Okay, that makes sense.
The correction is actually go back into the left, so that we're going to do in a second.
Oh,
That's going to open up the right, and then the right arm's going to get better. So
okay.
we have to get the curve back in your neck.
So
Now,
like my head is supposed to sit like this
well, this is how
in a
you're
neutral position.
correct. Yeah. Well,
That's
not.
crazy.
We're going to
This doesn't-
overcorrect.
Right.
We're doing a little bit of overcorrection.
Okay.
So
I see what
that
you mean.
if it's this way, we got to take it
That to get
there
it back
to get it
that.
to be in the middle.
Okay.
It's a little bit of an overcorrection. But yes, definitely more curved than where you are. And a couple things that go on when there's a curve in your neck, the nerves that go through these holes in the side are actually held loose, and so they have the ability and maneuverability to get away from any disc that's hitting them. So there's that hole on the side that the nerve's going through. If the nerve is held taut, it doesn't have any ability to avoid what's hitting it.
Yeah.
The curve in the neck gives it like a cooked spaghetti noodle, some maneuverability away from what's hitting it. So it almost makes a disc injury irrelevant the more curve that's in your neck.
Okay.
So really the first way to not only alleviate the disc movement back towards the spinal cord is to unweight the front. That'll allow the disc to move back forward, and then it also makes the nerve roots not so tight.
Yeah.
And it gives them some maneuverability. But
This feels really good.
and just keep your head straight for a second. Go back to
Oh,
straight.
sorry, I was
If know
looking
you're
at
good.
you.
This is good.
I
You're good.
didn't
You're good.
realize it.
You're good. I wanted a little bit left. We do want a little bit left, and it's 20 minutes of time to change your posture.
Oh.
And so go ahead and straighten that out, like if it's not too
Oh,
uncomfortable.
no.
There you go. So you just
Didn't even realize I was doing that.
it's okay, you're doing great. It is tough. Disc injuries, discs are not regenerable. They are like cavities. They're going to teach your neck to not bend there anymore, to
Okay.
chew on the other teeth in your mouth that aren't injured. And the curve in your neck seals that, meaning that it makes it continue to chew on the younger parts of your spine, not on the ones that are injured. Everything I do on the table is to make this effective and make it so that you actually can do it at a deeper level, and then it changes your posture.
I didn't do this in a day, so I know it won't get fixed in a day.
Right. I always think Rome wasn't built in a day. It was built in Italy, in a day. Anyway. In a day. In a day. It wasn't built in a day.
Cheesy.
I love the dad jokes.
In a day. Yeah, exactly. It's all I'm left with. I got 4 kids. I can do whatever I want now. And ice the lower neck. I would mainly avoid heat is the best thing.
Oh no! That's all I've been doing.
All right.
Have this conversation now.
Thanks for right. All right. This is not that rocket.
It feels good.
I know.
Sorry.
Stay right there. I'll explain. Don't move. All right. If you have heat, what's it cause? Swelling.
It makes sense.
I know. So you have a disc, which is made of 70-80% water, right? That's made of water. And you put heat on it, it's going to swell it more, causing it to herniate more. Heat blocks pain. I've had it described one way is that our body kind of fears fire, and so heat jumps the line. It's the first person to talk to the brain. So whenever you put heat on something, it blocks the ability for other nerves to get their signals through. So it's a distraction. It's a cover up. It silences the other nerves because heat jumps to the front of the line. So I understand that's why it feels good, but the worst thing would be chin down, hot shower hitting your lower neck. Yeah.
I don't do that at all.
Let's not do that.
At all.
I know. All right. Well, just even if
But I won't do it anymore.
if we stop having a fire and throwing gasoline on it, your fire is going to start calming down. Let's just. Well, no, I come home and I
I won't
go.
add more. It's
Oh, a little fire. Here you go. Oh my God.
I won't be a pyro.
The main thing is understanding that every time your chin comes closer to your chest, that's why you see me just staring off into space. It costs something. Every time your chin comes down, it costs your neck something. And so now the other alternative is then what people will do is they'll do this. They won't tuck their chin down, they'll do this. And now it's costing
yeah.
your lower back something. So somebody's got to take the...
Yeah.
Now if your arm starts to get more tingly, you're going to have to put another book behind your head. I have
Okay.
a book back here. The goal is to go slowly. We're trying to loosen the chest up.
Feels so good.
The more we get your chest loose, the more stress we take off your lower neck.
Nice.
Doing good?
Yeah.
All right.
Thank you
Pleasure.
so much.
All right, thank
I
you so much. All right,
appreciate
very good. Thank you.
Oh, that feels great.